So one of the themes we're going to cover are cultural challenges. So basically, even before the pandemic, it was pretty hard and tricky to sustain the culture of the company and continue, evolving it in the right direction. And then when we all suddenly went back home, it became quite hard, on the long term to motivate people to keep, like showing people that we embody the values they were hired, they believed in at the first place. Some people lost motivation, and I'm sure that even we lost motivation. So this is a point this is like the first theme we wanna discuss, starting with Nam. You were hired during the pandemic. I think you have even more insights about this. Any insights on the cultural challenges?
Yeah, no, absolutely. I was the first CPO the company ever hired. So actually the topic before this about the CPO finding a seat, that's a very, 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 very relevant to me. So it's very hard when, first of all, it's a C-level role and the first CPO ever. They don't even, it's a healthcare company, 17-year-old company, so it's not a startup or anything like that, SME. We sell to NHS primary care, so kind of very complicated space, quite old-fashioned actually, the way it works. And they don't really know what this product, it's a good thing, like we want to be product-led and all that, but nobody really knows what a CPO actually does. So it's very difficult in such circumstances, first of all, to be hired, and then how do you become influential in the workplace? So I think there are all these kind of difficult situations. My products are used by clinicians, by doctors. And as you know, the medical world, NHS went completely digital, completely virtual as well during the pandemic. So there are just multiple levels of chaos, I would say, and challenges. What I have found difficult is, I think it's very difficult when you're kind of coming up with new products. So one of my new products that we came up with last year, end of last year, was the COVID vaccine booking system. You can imagine that's kind of just amazing, right? It's the center of the public health system. And how do you even ideate? How do you even come up with a thing like this, so complicated? So we did a lot of these workshops with doctors and commissioners and things like that virtually over team calls, right? And those were really, really challenging. We really wanted to meet up, but then the lockdown, as you know, there was a very long lockdown, right, for like 4 or 5 months, and nobody could meet no one. So we basically launched that product in the middle of the lockdown early this year, and the first jabs were the Pfizer jabs that went on and things like that. It's a mature product now, but that time we built it based on a lot of assumptions, a lot of different things. And hindsight, I feel like if we could have met some of those clinicians face to face in a room like this, probably, and had done a few kind of whiteboarding sessions, etc., I just feel like it would have been a better experience, maybe a little less stressful. So my biggest challenge is in a virtual world, relationships are very transactional. That's one of my biggest challenge. And when relationships become transactional, it affects everything. It affects collaboration, it affects loyalty, commitment, all of those kinds of things, right? It's a domino effect. And I think that ultimately affects retention of employees as well, because people almost start looking at a job as a job and not anything more than that. So you jump on a Teams call, get out of it, go to another call. It's just call. And those little kind of impromptu chats that people used to have pre-COVID, I think those don't exist anymore. And I can tell you, we've tried different ways of doing kind of collaboration work, like team building activities virtually, with quizzes and virtual drinks, etc. Initially, I think it was okay. But towards the end, the moment I would say, what about virtual? Everybody would be like, no, no. So I think that became almost like a no. So yeah, complicated sector, complex environment, and on top of that, remote working. I think all of that has led to a lot of different challenges, which I think it will take a few more years to kind of mitigate.
Now I'm just curious, since you were already remote before the pandemic, did you see a difference in team morale and motivation when everything started? And you also spoke to me about the importance of feedback. If you can talk a bit more about it.
Yep. So just a little bit of context.